Welcome back. We're glad you're watching the Weekend Express. Time now for our interview segment. And this morning we're speaking on subsidized cancer treatment. The Kenya Cancer Association estimates that about 85 people die of cancer every day in Kenya, mostly due to late diagnosis and inaccessibility to treatment. And most of this is because of the high cost of a cancer treatment in the country. And we'll be speaking to two very specialized doctors and experienced doctors in this field. Thank you very much for joining us in studio. We have Dr. Catherine Nyongesa Wata, who is an oncologist at the Kenyatta National Hospital. She's also one of the founders of the Texas Cancer Center here in Nairobi, which offers subsidized cancer treatment. And this is something that very, very many Kenyans are interested in finding out about. But you're also the chairperson of the Kenya Society of Hematologists and Oncologists, so a woman of many capacities. Thank you so much for joining us in studio. We also have Dr. Kamamia Wamurisho, chairman of the Kenya Pharmaceuticals Distributors Association, and recently also the winner of the Building Nations Award for increasing access to affordable pharmaceuticals. Thank you so much, doctors, for joining us in studio. So cancer treatment, of course, cancer is now the third leading cause of death in Kenya. And this was announced just recently at a health summit. And Dr. Catherine, let's begin with you. Talk to us about the Cancer Care Center. This is which offers a subsidized cancer treatment. When was it established, and what informed that decision?
Okay, being an oncologist, I have quite a passion because I have very close family members who have been affected by cancer. One of them being my sister, the other one my father-in-law and my sister-in-law. So cancer comes very close to my heart. Right. And the challenges like I used to go through taking care of my sister as a medical student really informed me that maybe as I grow up in the medical field, I should take up this cancer problem and see how to address it. Right. And having worked in the public sector for a long time, I understand the challenges, especially the poor patient, the one who is not able to access healthcare very fast. Right. I used to face them, like I'm sitting in Kenyatta and this patient comes with very late stage cancer, and maybe the queue is very long and cannot access timely treatment, and just because the patient is poor. So because of that, I took it upon myself. I talked to a few friends to see how they can support so that we start the Texas Cancer Center, which has been in existence for now 6 years. Yes.
6 years. And what does the Texas Cancer Center do exactly?
Okay, we take care of the cancer patients. We treat using radiation therapy. As you can imagine, radiotherapy has been one of the biggest treatment where patients have to wait for a long period, but now the period has been cut down. Right. We also give chemotherapy. We offer palliative care to these cancer patients. And we've actually tried to negotiate with pharmaceuticals to give us the medication at an affordable price so that more patients can access the treatment.
Right, right. Yeah. And Dr. Murisho, you yourself have been very active in ensuring that cancer patients can access, not just cancer patients, but just Kenyans in general can access cheaper pharmaceuticals in the country. When did you begin that cause?
Well, sometimes in the year 2000, it is a very, very long history. There is a time people who are on ARVs, the ARVs were costing up to $1,000 US. At that particular time, Kenya was supposed to ratify its acts so that they be in line with what we call the WTO trade agreement, because Kenya is a signatory. And under that, we had one provision that is called TRIPS. TRIPS stands for Trade-Related Intellectual Property Rights. There's a treaty that controls properties which are protected by patents. By that particular time, all medicines were very expensive. So we got together as a group of Kenyan indigenous pharmacists, and then we decided that there's a way we can be able to bring in medicines, the same medicines, into this country from other markets whereby they have been put by the owner of the patent and the owner of the trademark, but at preferentially lower prices. So we decided to get together, and then we formed an association called the Kenya Pharmaceutical Distributors Association. And since 2007 and 2008, we started doing the process of parallel importation. Now, parallel importation is not is something which has been misunderstood to a very, very big extent.
Right.
Because parallel importation is, for example, if you want to buy a Toyota today, for example, it is not a must that you go to Toyota Kenya to buy that Toyota.
Right.
You can go to Dubai, you can go to Japan or any other country, bring the same model into this Kenyan market, but it will be at a lower price. That is what we call parallel importation.
Right.
Most of the pharmaceutical companies in the world have got factories in different countries. And obviously, due to many factors such as the cost of production, cost of labor, cost of electricity, and all those types of things, the medicines in those countries will be lower than what they are in Kenya. So what we normally do is that we buy those medicines, the same medicines, it's not counterfeit medicine, from those markets where they have been put by the owner of the patent or the trademark with his direct consent, and then we bring them into this country.
Right.
Now, this is domiciled under what we call the principle of fast sale. The moment somebody has sold his product the first time, he has already gained, and he can no longer control the second, third, or any other subsequent sale. Now, that is what we call parallel importation.
Right.
And through parallel importation, we have seen that the costs of medicines have basically come down by almost 30, 40 to 50%.
Right.
The only issue is that it is not widespread. So a lot of Kenyans have not been able to benefit
And I
from
just want
this.
to, due to interrupt you there, let's just paint a picture to Kenyans of just how much we're talking when we speak about parallel importation. And just a few figures here. For instance, the average wholesale price of a certain antibiotic for pneumonia manufactured by an international pharmaceutical firm would cost 1,500 shillings in the UK. But in Kenya, the same thing would cost 9,500 shillings. That's 8,000 shillings more. And another one here, a cancer drug manufactured by a pharmaceutical giant costing 60,000 shillings in India, in Kenya costs more than 200,000 shillings. And so this is what Kenyans have been complaining about, the high cost of medicine. But why then, if there's that option that you're speaking about, why then do we still have such expensive medicine in the market?
One of the issues is that it is only 1 month back that the Pharmacy Operations Board has put into place mechanisms to regularize the process of parallel importation. The whole of last week, we were in a retreat in Naivasha when we were coming up with these guidelines. But one of the issues I can say is that Kenyans have been exploited to such an extent that it is basically immoral. The figures we are talking about are basically a drop in the ocean. You are going to find that medicines are more expensive in Kenya than they are in Europe and in the US. Yet those countries, their per capita are higher, they have got health insurance and all those types of things. So the major question we have been asking, the big question is, why do these big companies, who basically are the multinational companies, continue to sell medicines to Kenyans? Kenya is a third world country at those prices, to such an extent that people are dying not because of lack of medicines. Medicines are available in all the chemists. But can people afford them? This is the issue.
Right.
It raises a moral and an ethical question. How long is this going to go on? And I believe that because we are now taking the process further, we have already called on the government to put in other mechanisms that is going to address the issue of cost of medicines.
Right.
And one of them is that we may have to go the way banks and petroleum industry have gone. We may now have to start talking about having price controls, price regulation in the pharmaceutical sector.
But just other than pharmaceuticals, because I understand the importation laws also really play a big role in this. But Dr. Nyongesa, let's talk about importation laws. How do they affect, say, Texas Cancer Care in terms of importing medical equipment?
Okay, the issue I think is also on any importation you have to pay taxes, and probably that one also pushes the cost of importation a bit up. And we are hoping maybe in future the government can waive taxes on cancer equipment, and at least it will come out cheaper for the patient.
Right.
Also, the issue with cancer equipment is the maintenance. We don't have a local maintenance company, and if you buy these equipments from overseas, when it breaks down, because machines will break down, you have to get somebody from overseas to come and guide the local people on how to maintain the machine. And this is also expensive.
Right,
Yeah.
right. Now, of course, for the Kenyan watching at home now, the first question is, I want to access subsidized cancer treatment. Where do they begin?
Okay, one is you must be confirmed that you have a cancer. Once you've been confirmed you have cancer, your doctor, the primary doctor, will advise whether you need surgery, you need radiotherapy or chemotherapy. So if it's, for example, surgery, it can be done even at the county level. Unless it's an advanced surgery, then you'll be referred to the mainstream hospitals. When it comes to radiotherapy, we have actually we negotiated, we requested a National Hospital Insurance Fund to see if they can fund these patients in terms of treatment, and they kindly accepted. And I can tell you, if one has a National Hospital Insurance Fund, they get treatment basically for free. Using their card, you can get radiotherapy, you can get chemotherapy. And if one is paying cash, at the Texas Cancer Center, we charge 3,000 shillings per session of radiation, compared to other competitors, which the cost has been almost like 10,000.
Wow.
Yeah, so we helping a lot of people who cannot afford the expensive treatment.
Right, right.
Yeah.
And you've talked about NHIF, because I understand just a few years back, cancer centers in Kenya were not recognized as hospitals, so patients could not use their NHIF cards, but that now they're recognized as hospitals?
Now, I think because of the need, you know, the need for the patients to access this treatment, the National Hospital Insurance Scheme has actually accredited many hospitals, to use the card.
Right, and Dr. Murisho, let's talk about the medication, because you know, patients will also be prescribed medication. And many times you go to a doctor and they prescribe, you know, the most expensive medicine that there is, and they tell you the cheaper one is the counterfeit one. Like you just told us the cheaper ones are not counterfeit. So when it comes to cancer especially, where can patients access this subsidized treatment?
Now, most of the anti-cancer drugs are available, especially in the private sector. In the government sector, we do not have a lot of these medicines over there. But if people came to the chemist, especially where our neighbors are, I don't want to name those premises, they will be able to get those medicines at prices which are basically affordable. I can mention that there's one drug for the management or for the treatment of colorectal cancer. I'm capable, through parallel importation, of buying that product from Turkey.
Right.
And I'll be able to give it to the patient at about 130,000. That is 3 injections. This goes per month.
And how,
if you
how
are to
much
buy
does
that
normally
product
go?
locally, they are going to buy that product at between 360,000 to 380,000.
Right.
So what is important is for us to expand the process of parallel importation so that we have more players in this game, so that these drugs can be available everywhere.
Right.
Apart from that, the big guys who have had a monopoly for all these years, they also require to sit back and then they look at their pricing structure. They ask themselves, is it possible for us to remove all these other additional costs that we put in, all these big markups that we put in? Because what is important is, when a product becomes available, it will be used by more people. Even in terms of economics of scale, even those companies will be able to sell more. But I believe that what is now in the management of cancer that is way out of reach of most of the people are the newer molecules, which are more effective. They have got more friendlier dosing regimens, and they have got less side effects. Some of the very, very old molecules that we started with in those years, 1960s, 1970s, today they are still being used, but they are not capable of giving the best treatment advantage to the patient.
Right.
The reason being that the newer molecules are too much highly priced. And it is quite important that our patients should be shifted to the newer molecules as well, because they have got friendlier regimens and they have got less side effects. One of the issues you have noticed is that when patients are put on anti-cancer drugs, the anti-cancer drugs have got a lot of very, very severe side effects,
Right.
including weight loss, nausea, loss of hair, and all those types of things. And it is normally a pity to see that that patient who is suffering from cancer has to suffer another extent because of the drugs they are using. Yes. Apart from that, we also have got other medicines that we normally use for the management of pain, because cancer is normally a very painful condition.
Right.
And even these drugs, they require to be made accessible. Most of them are controlled because they belong to what we call the opioid class of drugs. These are basically heavily regulated. But we require to come up with systems to ensure that at least in those facilities that have got cancer specialists, these drugs are available. I've also seen in the last few years that quite a number of companies have come up with their own initiatives of supplying, especially Kenyatta National Hospital, with anti-cancer drugs at prices that are far much pocket-friendlier. You find that the prices of these drugs in facilities such as Kenyatta National Hospital are far much lower than in the private sector. And I believe the people who have been doing that, they have been doing something positive, and they require to expand their horizons so that they cover as many people who are suffering from cancer as possible.
Right, absolutely. And of course, in the course of bringing cheaper drugs or pharmaceuticals into the country, you've experienced quite a lot of challenges. Many call what you do business for humanity as opposed to business for profit. But these giant pharmaceuticals are in business for profit. So what are some of the challenges that you've experienced? Because of course they are fighting back to ensure that they can still have this market and supply the expensive medicine that they normally give.
The biggest challenge has been labeled counterfeiters. And in actual fact, a para-imported product is not a counterfeit.
Right.
It is a genuine product which has been put to the market by legitimately, by the same owner of that patent, of that trademark. So what these people have done is that because obviously people will basically buy our products as compared to them, is that they have spent so much of their effort through by publishing and spreading negative propaganda that we are bringing counterfeits. In other instances, we get our drugs being held at the port for necessarily long periods of time, leading to us incurring very, very heavy demurrage charges. Other times, police have been sent to raid our premises, our drugs have been confiscated, and all those types of things. But I can tell you, over the last 1 to 2 years, things have started changing, and even now the government is supporting us. What is important is that we have to notice that these multinational companies have got a very, very big presence in this country. And they have got their own connections. For them, if they wanted to speak to anybody in this country, they would just a phone call away. But for us, it's a very, very long process. So it's a challenge. It has been very, very difficult, but we are going to win.
Right.
With the support we are getting now from the new cabinet secretary, Dr. Meru, and the principal secretary, Dr. Moragori, this is a process that is going to be won. And I guarantee you that in the next few years, medicines will become more affordable to the people of Kenya.
Right.
This is what KPD looks for, and this is what it starts for.
That's a great cause. And Dr. Nyongesa, I would understand that the number of cancer patients who cannot access treatment in the mainstream hospitals is rather high. So Cancer Care Center must have a lot of these patients coming in. Do you have the capacity to handle all of them?
I'll say always there's a step. Always everything starts with one step. And we've made strides in the past 6 years because, you know, cancer care, it's a big giant. And you can see even the government has been struggling. I mean, if you look at Kenyatta National Hospital, it is not like a simple thing. Like all of a sudden you'll have a huge capacity, but there are steps. And I would say in the past 6 years, Texas Cancer Center has made big steps in terms of just one is making cancer treatment accessible to as many patients as possible. We cannot say Texas is going to take care of the whole of the government's problem, but I'm sure the other major players in the country who are also doing a very commendable job in terms of taking care of these patients. And in future, actually, Texas also hopes to bring more machines to increase the capacity to take care of these cancer patients.
Right,
Yes.
right. And speaking of capacity, one of the biggest problems at the Kenyatta National Hospital is the long waiting list. So sometimes even if patients did get the money to, say, afford that one round of radiation, they just had to wait so long on the list. Do you have such problems at Texas Cancer Care?
Okay, at the moment we don't have a long waiting list. At least patients are being treated within a week of being attended to. But as patients become more aware of a facility, I'm sure the numbers are going to increase, and that is going to put pressure on the management to put more radiotherapy machines. And also we are actually putting another center in Eldoret to try and decongest Nairobi to take care of the people from that region.
Right. In fact, your location is one thing we did not talk about. Where in Nairobi are you based? Okay,
the Texas Cancer Center outpatient where the radiation services are offered is on Bagathi Road, just near AP camp or on your way to Strathmore University. And then we have the inpatient center at the Hurlingham Shopping Center. And then now the third facility is going to come up in Eldoret. Yes.
All right. You're watching the Weekend Express. We're speaking to Dr. Nyongesa and Dr. Mirisho on subsidized cancer care. If you have any questions or any comments on this subject, do feel free to call us live on our lines. But these are not the only institutions or hospitals, rather, that offer subsidized cancer care. The Karen Hospital in Nairobi has just recently also expanded these services and offers subsidized cancer treatment as well. The CEO of Karen Hospital, Dr. Betty Gikonyo, could not join us in studio this morning, but she did have a message for cancer patients as well as families and friends of those affected by cancer. Let's listen in to that message.
We get advantage as hospitals on taxation of equipment so that we are able to get the best equipment for our patients, so that without having to pass extra cost to the patient. That has been there in years gone by, and this is a new dispensation that has brought more taxation to the medical equipment. And the third one was about capping the doctor's fees. We have just seen the bold step that the banking sector has been forced to go has been put in, the bold step that the government has taken on the interest rates, capping the interest rates, so that we as Kenyans can borrow money at an interest rate that we can afford to pay back without having to have our assets mortgaged or rather auctioned. So we need to look at other specialities. There are other professionals, architects, engineers, lawyers, surveyors, all have a guide, not just a guideline, but something, a fee structure that is understood by the consumers. In medicine, in doctors, there is no such a thing. There's something called a fee guideline by the Medical Practitioner and Dentist Board that there is no commitment to actually enforce it, and we would like to see, as doctors, that route be taken. And the final one that I mentioned was, if we could manufacture. Manufacturing is what will convert us from a second world to a first world. Manufacture the medicines we consume. Manufacture the consumables we consume. Manufacture equipment that we use in medical facilities. And indeed, go to the step of going to that high-level, high-tech equipment that is costing us so much from the first world. The former higher cause of death in our country, which was infectious diseases. So when I trained as a doctor, infectious diseases were the greatest cause of death and hospitalization. As we have continued to practice medicine, that has been overtaken by cancer, heart diseases, diabetes, and other non-communicable diseases. Regarding cancer, I think there is something that we all need to put it very clear. We need to start from the stage of before the cancer appears, what do we need to do? And that's where the wellness program, being able to be checked not when you are feeling pain or when you have, some discomfort, but when you are feeling well, so that we can detect, so that we can give you either a green bill of health and you have peace of mind to carry on your work, or if there's something, it is detected early so that then it can be treated, and cancer detected early can be cured. Now, in Kenya, we have modalities for this pre-cancer diagnosis, which is the wellness examinations and screenings. Then there are some very good tests that have come up over the years called cancer markers that can actually, is a blood test, and with that blood test, you can actually exclude quite a number of cancers.
All right, that is a message from Karen Hospital CEO, Dr. Betty Gikonyo, and a few things that she brought up, especially manufacturing our own pharmaceuticals in the country. Dr. Murisho, has this been happening, or are we still a long way before we get there?
No, we are doing very well as a country because so far we have about 62 pharmaceutical firms who are manufacturing drugs in this country. Now, the only problem we have with our manufacturers is that they are all making their own molecules, the ciprofloxacins, the paracetamols, the tinidazoles, and all those types of things. Now, one of the issues that we require to know about cancer is that treatment is very, very complex. It requires serious research. And apart from some few countries in the West, and in the US and India, in Africa, I don't believe there is any facility that is manufacturing anti-cancer agents. But I believe that through what we call technology transfer, we can have factories coming from areas with experience such as India or US or Europe. They come and set up facilities over here. And then we can also train our own manufacturers. They do what we call technology transfer together with some of our very reputable pharmaceutical companies, because we have got companies who have got even a GMP from the WHO. They have got the facilities so that at least we'll be able to manufacture locally. The advantage of manufacturing products locally is access. If today somebody wanted an anti-cancer agent urgently, it will take me about 48 to 72 hours to get it into the country. But if the product is being manufactured locally, it's just a matter of hours. The other thing that has been going on is that the regulator, that's the Pharmacy Operations Board, they have been fast-tracking a registration of medicines that are used to treat cancer.
Right.
So if you came up with a dossier or you came up with a product that you wanted to register to treat cancer, it will jump the queue so as to increase access. So all these initiatives have been there, but I believe that as a country it is quite important that because cancer is now one of our greatest challenges, we think of establishing facilities whereby we can be able now to manufacture drugs for treatment of cancer. And not only drugs for the treatment of cancer, the newer molecules, which, as I said earlier,
So we need to
are
move
more
with that
safer.
technology.
Yes, are more safer, less side effects, and have got more friendly treatment regimens. Yes, that's the way we should go as a country.
Right, right.
Yes.
And then when you talk about cancer, there's also palliative care. And Dr. Nyongesa, just explain to us, what does palliative care mean?
Okay, palliative care, really it's a multidisciplinary approach in taking care of a cancer patient when the cancer is not probably curable, but the patient needs a better quality of life.
Right.
Because at that time, you're not looking at the quantity of life, but the quality of life. You want to be free of pain. You want to be close to your family members. And also, and palliative care also involves, for example, even giving chemotherapy to relieve symptoms, giving radiotherapy to relieve symptoms when the cancer cannot be cured by surgery, for example. And even the spiritual aspect, good nutrition for this patient. So it is a very wide topic, but really just focused on the quality of life of that patient.
Right.
That even if you have 6 months to live, you want good quality life. Yes.
And of course, you mentioned at the beginning that cancer is very close to your heart because a lot of your close family members have been affected by it. But as you mentioned, Dr. Murisho, cancer is becoming or is an epidemic in the country, really, but more so among the young population. And normally doctors would say, change your lifestyle. We're adopting the Western lifestyles. But what lifestyle changes, to be specific, are we talking about we need to make as Kenyans to change this epidemic?
One of the biggest causes of cancer, actually 20%, is caused by cigarette smoking. The other is caused by alcohol. The other is caused by the exhaust we get from the motor vehicles.
Right.
Now, one of the initiatives we have noticed from the last 2 weeks is the new mark they have put on the cigarettes. I don't believe anybody will be able now to see anything nice from that pack of cigarettes. So let us try to avoid smoking.
So they have more graphic pictures.
Yes,
you're
it is
talking
there.
about having very
It is
graphic
there.
pictures.
It's basically one with a person who is suffering from mouth cancer. Now, it has taken effect. And now, these are the initiatives that got to be put across to discourage people from smoking. Because smoking accounts for about 20%. Apart from that, is regulation. We require now to come up with regulations that are going to reduce emissions from our motor vehicles. Reduce intakes of the sugars and all those types of things. Obesity it also leads to cancer. We require now to train our people to come up with better lifestyles. They reduce obesity, they reduce the foods that do all those types of things. Then also the products we're importing. There have been a lot of concerns about the quality of some of the foods we import into the country because of the sources they are coming from. So we require now to have a lot of stricter controls, especially at the ports of entry. If you do recall a few years back, there was this nuclear leak in Japan. Now, we are still importing a lot of vehicles from that country, probably even from areas allowed where there was that nuclear accident. At our points of entry, in all our ports where we're importing our motor vehicles, have we put in place enough and stringent enough regulations that are going to be able to detect any level of radioactivity in all the imports we are bringing to this country? These are the questions we require to do that.
Right.
And I would urge the government to start taking these issues more seriously, to put in place measures that are going to discourage people from any lifestyle that are likely to lead to cancer and all those types of things.
Right. And Dr. Nyongesa, let's talk about the more common forms of cancer among women, cervical cancer and breast cancer to be specific. Many women are very concerned about this, how especially cervical cancer, how can they prevent it? There's the HPV vaccine that many are still not aware about. Where can it be accessed?
Okay, yeah, cervical cancer, it's, okay, some cases, maybe 10 to 20% of the cases, the cause is unknown, but 90% it's related to the HPV vaccine, I mean the HPV virus.
Right.
So by immunizing young girls around 13 years, 14 years and below, it can prevent the development of this virus in the cervix and probably reduce the chance of having cancer. These vaccines are available in major hospitals, really. At the moment, it's not freely available in the government hospitals, but I'm sure in private hospitals it's available. And in government, there are steps to have it.
How much does it go for?
I think a dose is about 6,000 Kenya shillings. Yes.
And that does not work for the older generations, just for the younger girls, because you can find women at the age of 30, 45 and above using the vaccine, and then it doesn't work.
Really, you know, immunization best works when you have not been attacked by that virus.
Right.
Just the way we immunize our children before 9 months with measles vaccine, before they get the measles infection. So it's the same. Once you become sexually active, the chance of you having been infected by the virus is very high, and by being vaccinated may not really help.
Right.
Yes.
Right. And then for a lot of the cases, other than inaccessible treatment or the high cost of treatment, it's just because of late diagnosis. So people go and get diagnosed with cancer, but they're in denial, and so they retreat to a corner for several months and do not seek treatment immediately, and that also leads to cancer. How can Kenyans be sensitized about accessing medical attention urgently?
You'll be surprised. Our patients present quite early, but then they're misdiagnosed. So it will start all over from the medical fraternity, better training, better sensitization, a high index of suspicion, such that when this patient presents to the level one hospital, the doctor or the clinician or the nurse has been trained to actually pick these early signs of cancer. And that will improve. So, and then the next step is also creating awareness to the members of the public that these are the common symptoms of cancer, and if you have these symptoms, you seek treatment early so that we don't have this late diagnosis. And then, as you said about people retreating to the corner, you know, cancer diagnosis is a very scary thing. And believe me, even the doctors, everybody's scared of being told that probably you could be having cancer. But then it's a reality, and when it knocks on the door, you just have to face it and get treatment so that you lead a better quality of life. And cancer in early stages can be cured. And that is a positive thing, and people should not be scared. Really just come forward and get help, because there's help out there. And we know very long-term cancer survivors who are encouraging other people having cancer, that cancer is not a death sentence.
Absolutely.
And as a chair of the Kenya Society of Hematology and Oncology, we are holding a conference in November this year, and the theme really is taking cancer care to the community. And that is our biggest passion this year, such that we are going to educate the people in the community. We'll get people from all over the country to come and attend so that they can know how to pick cancer early, what are the methods of diagnosing and treating cancer, and which places can one seek help if you suspect you have cancer. Yes.
All right, thank you so much for that, Dr. Nyongesa. Dr. Murishi, let's get your last word on this.
I think it is quite important that Kenyans have methods and mechanisms of availing medicines that are affordable to them. Because you see, at the end of the day, you can go to the best doctor, you can go to the best laboratory, you can go to the best treatment. The medicine is that thing that you take away with you that is going to assist you to get well. If this medicine is not affordable to you, then everything that has been done down is undermined, and it does not lead to anything. I believe it is quite important that the government now puts its foot down to ensure that the guidelines which we developed last week are captured in Cap 244, the Pharmacy Prisons Act, so that parallel importation is now open to everybody. We don't want parallel importation to be seen as a preserve of a few people. Apart from that, it is quite important that the government to start looking at issues of regulating prices of pharmaceuticals in this country, because I can guarantee you they are way out of reach of most of our people. Finally, we are having a very serious issue by our prescribers. Our prescribers are doing some good work, but they have to stop prescribing medicines by broadening. Because what happens is that companies sell their bloods to the doctors to prescribe their own particular blood. If we went by what is in the Kenyan National Pharmaceutical Policy, this is a 5-year policy that guides the pharmaceutical sector in the country, it says that all prescriptions should be by generic name, so that it is a pharmacist who will be able to choose the generic that is here. And we have said very well that generics are equivalent to blood products. Generics are not counterfeits. Parallel imports are not counterfeits. A generic is a product whose patent has expired, so that formula becomes available to anybody who wants to make that product. If we started prescribing by generic name, I promise you prices of medicines are going to go down. So that this issue of a patient moving around with a prescription from one chemist to another, getting a quotation, at the end of the day, ends. So we require those three mechanisms: parallel importation, price regulation, and prescribing by generic name. That way, I guarantee you, we'll be able to do a lot of service in the health sector.
And we do hope the Ministry of Health works together with all doctors and oncologists to ensure that we are able to solve this epidemic. Thank you so much for speaking to us. We've been speaking to Dr. Catherine Nyongesa, an oncologist at the Kenyatta National Hospital. She is also one of the founders of the Texas Cancer Center, which offers subsidized cancer treatment. We also have Dr. Kamamia Wamurisho, chairman of the Kenya Pharmaceuticals Distributors Association, who's been very active in championing for the importation of cheaper medication in the country. And special thanks also to Dr. Betty Gikonyo, CEO of the current hospital, which is now also offering subsidized cancer treatment. And that brings us to the end of this interview. For now, you're watching The Weekend Express. Let's take a short break. We'll be back with more.